Yes, I have. It's 7:30, so I'm going to start. Oh, I have to be introduced. You can tell people who I am. Thank you.
Thank you. Well, welcome to this program. I'm Gini Stimpson, and this is a program planned by the Neighborhoods Committee. But I want to say that Tom contacted us and offered to come and do this program. And what could be better than that? And we're hoping that we learn from him sharing, and he hopes to learn from some of us sharing tonight also. So many of you know that Tom Rasmussen served on the Seattle City Council from 2003 to 2015. He's been a longtime volunteer and advocate for seniors and people with disabilities and for the LGBTQ causes. He's the first and only openly gay Seattle City Council member that we've had. So we're happy to have you here, Tom. Part of the inspiration for this is there's a wonderful AIDS Memorial Pathway up by Cal Anderson Park, well, mainly through Cal Anderson Park, but a little bit north too. And we're going to hear something about that, but we're going to be reminded about the history of AIDS in Seattle too. So Tom, thank you so much for coming and sharing with us this evening.
Thank you, Jenny. Thanks very much. As Jenny said, we're going to have a walk this coming Saturday at 10 o'clock up on Capitol Hill at the north end of Cal Anderson Park. And that's where we have created a memorial as a place of reflection and remembrance for people who we've lost to AIDS. We want to tell the story of the history of HIV/AIDS, and we want to call people to action to fight AIDS and discrimination against people, because there's no vaccine for AIDS and there's still no cure for AIDS. So it's a reminder that it's still with us and affecting millions of people. But I thought that before the walk on Saturday, it might be good to talk a little bit about the history of HIV/AIDS in our community, and then how our community responded to that. So that's what I will do first. And then what I also want to do, because we have incredible people here tonight who are really involved in HIV/AIDS and medical and healthcare and neighborhood and community activism, who will have, I'm sure, stories to tell. So I don't want to take all of our time. I understand we have about 60 minutes, perhaps a little bit longer, but if I see people starting to wander out, I'll know it's time to shift gears and go to the stories of other people. And talk slower. Okay, well, I almost just got off the plane from Lima, Peru. I was hiking in the Andes, and my ears are still plugged up from flying about 12 hours. But anyway, so I'll try to talk slower. Thank you, Jenny. And hopefully all of you can hear me. But we have Congressman Jim McDermott here, former Congressman. Representative Seth Armstrong is here. I don't know if there are any other former elected officials who are here now, but I want to say thank you. I'm really honored for you to be here, and also for your role in fighting HIV/AIDS and discrimination. And I hope that we are able to hear from you a little bit later after my presentation. I thought I'd start pretty much at the beginning, when HIV/AIDS was almost recognized in our community and known. And in start back a little bit, in the late 1970s, there was a tremendous amount of activism for gay rights in the United States. And it was being fought city by city. And that was in the late 1970s. And I want to ask you this. Do you know who this is? Do you know why this album is here and who this is? What do you remember about Anita Bryant? She, Miami, Florida, passed a gay rights bill in 1977. And Anita Bryant, who I think was Miss America at one time and also spoke for the Orange Commission, took the lead in fighting that, saying that we're going to, I say we because I'm gay, we're going to recruit people because we can't have children. So anyway, she fought the discrimination, or she fought the anti-discrimination law in that was passed in 77, and then she succeeded in 1978. So that was in the late 70s. Seattle had already passed an anti-gay an anti-discrimination law in 1973, so we were way ahead of the time. 73 was passed and sponsored by Jeanette Williams, who I worked for, not at that time, but shortly after that. So this was Florida in 77, and this was the environment that we were facing and fighting. And the way the gay community did that is that we organized throughout the U.S. I bought this T-shirt in San Francisco at that time. I was down in San Francisco in the 70s. It says, yes, good question. What does it say? It says, Anita dear, cram it. The fruit commissioned to squeeze Anita. So this was about 1978 when she was campaigning against gay rights. So this is, it doesn't have any moth holes in it yet, but that was a T-shirt I bought down in San Francisco during that time. Didn't she sponsor Orange Juice? What's that? Yeah, she headed up the Orange Commission there. She was their spokesperson, and so anyway, they regretted that later on. So that was the environment that we were facing in the late 1970s. Harvey Milk had just been killed, 1978. He was assassinated, and then many other cities repealed any gay rights ordinance that they had. So there was a lot of activism to fight those anti-gay initiatives. And then what happened is we started hearing about this really weird disease that was beginning to affect gay men. And that was in about 1981. So this is a bit my story. This is a bit of the national story. In November 1981, I went to New York to visit my boyfriend, Steve. And this is a photo of us. Steve worked for what was then Northwest Orient Airlines. He was a flight attendant, and had been based in New York, and I went to visit him for Thanksgiving. So this is us on the ferry to the Statue of Liberty. So Tom is on the left, that's me, when I had a mustache, and Steve on the right, who also had a mustache. Also, a person came with us on that ferry in November 1981. And I want you to see him, and I want you to see that background too. What do you see in the background there? World Trade Center, right? Yeah, so keep that photo in mind. I can come back to that. Within about a year, reporting began on this mysterious illness that was beginning to affect gay men. And now I have a brief recording on that. And Chase, who's been incredibly helpful setting this up, is going to make sure you can see this.
Centers for Disease Control in Atlanta today released the results of a study which shows that the lifestyle of some male homosexuals has triggered an epidemic of a rare form of cancer. Centers for Disease Control in Atlanta today released the results of a study which shows that the lifestyle of some scientists at the National Centers for Disease Control in Atlanta today released the results of a study which shows that the lifestyle of some male homosexuals has triggered an epidemic of a rare form of cancer. Robert Brazil now in Atlanta.
Bobby Campbell of San Francisco and Billy Walker
in Atlanta.
Bobby Campbell of San Francisco and Billy Walker of New York both suffer from a mysterious newly discovered disease which affects mostly homosexual men, but has also been found in heterosexual men and women. The condition severely weakens the body's ability to fight the disease. Many victims get a rare form of cancer called Kaposi sarcoma. Others get an infection known as pneumocystis pneumonia. Researchers know of 413 people who have contracted the condition in the past year. 1/3 have died and none have been cured.
Death didn't scare me. It was living with this for a long time. That's more frightening than death.
Investigators have examined the habits of homosexuals for clues.
I wasn't the fast one in terms of the way I lived my life, and now I'm not.
The best guess is that some infectious agent is causing it.
Today, researchers here at the National Centers for Disease Control said that they found several cases where people who had been sex partners both had the condition. The scientists say this probably means they are dealing with some new, deadly, sexually transmitted disease.
The investigators see this as a serious public health problem.
From an epidemic point of view, there have been more deaths from capsular sarcoma and pneumocystis pneumonia than have occurred with all the cases of toxic shock syndrome and the Philadelphia outbreak of Legionnaire's disease combined.
Researchers are now studying blood and other samples from the victims, trying to learn what is causing the disease. So far, they have had no luck. Robert Bazell, NBC News, Atlanta.
So many. That's the focus of an award-winning documentary that Premier Spencer Michaels talked with the filmmaker in San Francisco.
So I was able to stop that. Thank you. Anyway, so that's what we were beginning to see and hear reported back in 1982. The first cases that we know of were reported in New York, San Francisco, and Los Angeles. Major populations of the gay community had moved there because those seemed to be more friendly, supportive, and safer communities. Seattle was not experiencing the first HIV/AIDS cases or aware of them until a little bit later, perhaps a year later. And in 1982, there was a headline in the January 1st, 1982 Seattle Gay News that there was a disease in the gay community, but no one knew what it was. And at that time, it wasn't called AIDS; it was called gay cancer, because what people were getting was Kaposi's, which is a cancer of the skin, or pneumocystis, which is a type of pneumonia. The reason why you see so many images, and we'll see so many images of the Seattle Gay News, is it was the one paper that we could really count on that would cover this issue more closely than any of the other papers in our community in this area. Most of the time it was accurate. I love the SGN, as we call it, the Seattle Gay News, but it was there and it was covering that story from the get-go, and it put it in the headlines. And the SGN, the Gay News, was out every week. It was on the newsstands every week, and it was really an important source of information for us. And this is what we saw. These are the images that we saw. Didn't know what it was, scaring the hell out of us, wondering if it's going to affect us or who it's going to affect next. Now, there is a major role for government in public health, as you know. And here is what the response of the White House was within a year after the first cases of this gay-related disease or cancer was announced. And this is a White House briefing by Larry Speaks in the Reagan White House. We're gonna turn this up, so I'll start it again. Thank you, Chase, for running back and forth. Okay, so that was the reaction in the White House. A reporter asked, what does the president think about this gay cancer, this gay disease that's killing people? And the audience erupted in laughter. You heard them, reporters laughing. People were dying, and they were laughing. And that was part of the challenge with HIV/AIDS, is that people were blamed and shamed, didn't want to talk about it. It was a potentially a sexually transmitted disease affecting the gay community. And if I don't have it and you don't have it, then you're probably not gay and you're okay. That was the reaction. Even though this plague was already infecting many, many people, thousands of people in the U.S., and the Reagan administration was doing very little to close to nothing at that time. Now, to be fair to the scientists, they were scrambling to put funds together to begin to investigate what's going on, in spite of the intransigence of the Reagan administration. The Reagan administration was committed to reducing government, cutting funds for public health, cutting funds for health research. And this was one of the areas where they cut. It's gay people, right? Gay men. Cut that. Sound familiar? So that's Larry Speaks, spokesperson for Ronald Reagan. Oops, did I hit the wrong button? I think. Okay, so we'll go to the next one. So first case was diagnosed in 1982 in Seattle. Seattle and Dr. Kaharick and Congressman McDermott know full well Seattle, King County, and the state of Washington responded pretty fast, or as fast as they could, to what they saw that was going on compared to other places in the United States. What you see here is from 1983, the Seattle King County Health Department was already beginning to put out information about AIDS. And you can see they used it as by a cassette. Does anyone have a cassette recorder or player anymore? But it attempted to explain AIDS in good, clear language that would be useful to the community. And the King County Health Department was really a leader throughout that entire period of time. King County Health Department is funded by Seattle and King County and other public funds. But we can be, including today, very proud of the health department that we have with the Seattle King County Health Department. In '83, because of the shaming and the blaming and the fear and the unknown of what was causing this, there was a lot of paranoia. So people began to think, well, the police, maybe the police are behind this. Police are refusing to provide service, and perhaps there's a list that a secret list that police are keeping of people with HIV/AIDS, so that if a person gets hurt, assaulted, needing help, you would avoid going to that person, right? And so George Bacon, who you see is there with his picket sign. George often had picket signs throughout his life as the head of the Seattle Gay News, was confronting the police department saying, tell us, do you have a list of people with AIDS, with HIV, so that you could avoid helping them? They denied it. I don't know if it existed. The mayor denied it. The mayor said it should not happen. That was, who was the mayor? I think it was Royer at that time. Then, because of this great fear, Channel 5, King Television, did an amazing job of investigating and reporting on HIV/AIDS when many other media outlets avoided that. And Jean Anderson was given this assignment to report on HIV/AIDS, and here's what she said. We'll go back to the beginning so we can turn up the volume.
Fear has become almost as much an epidemic as AIDS itself.
As we mark 70 years of broadcasting here at King 5, we want to take a look back on a time when rumors and myths were swirling around a frightening new disease that was killing people.
Some newsrooms were reluctant to talk about HIV and AIDS, but not King 5. Ted Land takes a look back. There is a fear that stalks our community.
In 1985, as a terrifying new virus was spreading, King 5 went on the air with a documentary called Living with AIDS. Gene Anderson set out to understand what was known about HIV and AIDS and to dispel myths.
So you can't get AIDS in a restaurant that gay people frequent?
The next year, what was then the Seattle-King County Department of Public Health sent a letter to King 5, thanking the station for its decision to run the documentary, as well as public service announcements, something other stations would not do. Quote, King has led the local electronic media in its contribution to control of both the AIDS epidemic and the resulting public hysteria.
In the early days, everybody was scratching their head, wondering, what's happening here. And it was very scary.
Dr. Robert Wood, who is now retired, wrote that letter. He was director of the AIDS Project in 1985 and was featured in the King documentary.
There was, I think, a lot of media concern about talking about the populations at risk because they were stigmatized and pariahs. They were gay men and they were avid drug users.
A King 5 poll from 1985 showed there was a lot of misinformation swirling.
24% worry about working with someone who has AIDS, and 29% worry they'll get AIDS if they use a public restroom.
The station's reporting cut through the rumors.
The AIDS virus is carried in body fluids. It is not spread by casual contact. Not in a restaurant, not in a restroom, and not in the office.
A lot has changed since then. There's now a pill to prevent HIV transmission, and those who have the virus are living long lives thanks to advances in treatment. But there's still a lot of work ahead. Nearly a million people around the globe died from AIDS in 2017. If Dr. Wood were to write a headline in 2018, it would be this.
HIV and AIDS are still major problems.
Ted Land, King 5 News.
Okay, thank you. So that was reporting from on a previous public service announcement and report done by Gene Anderson in 1985. And so in 85, Ryan White, you may have heard of Ryan White. He was a young man who contracted HIV through blood transmission. He was a hemophiliac. In 85, he was denied entry into his middle school. That was a kind of fear. The majority of Americans supported quarantine of people with HIV/AIDS. And Ronald Reagan, for the first time in 85, nearly 5 years after it was first identified, mentioned AIDS for the first time, 5 years later. It was proposed by some people like Patrick Buchanan, a conservative columnist, that food service workers should be banned from serving in the restaurant industry, and other people proposed tattooing people with HIV/AIDS infection. Again, this was the Reagan era of cutting the budget, cutting funding, including for public health. Because of the need for volunteers and for services for people with HIV/AIDS, there wasn't enough funding to go around. And so many nonprofits were created and volunteer organizations were created by people in Seattle to help people with HIV/AIDS. And one of the early ones was called the Chicken Soup Brigade. That gave people rides to their doctor's offices. It brought food to people, it brought groceries to people, it provided companionship to individuals with HIV/AIDS, people who were often quite alone, who had lost their friends or had lost their family. And so Carol Sterling was the first person who's hired, the first paid position hired by Chicken Soup Brigade, and she hung in there for a long time, carrying out this incredible mission and responsibility of managing volunteers, recruiting and coordinating volunteers, and providing direct service herself to people with HIV/AIDS. And I just want to share a brief summary of what she had to say about her time as the coordinator of the Chicken Soup Brigade. So, Chase, do I just click on something? Okay, so here's Carol's story. This is years after she served on the Chicken Soup Brigade staff. Great.
This is why I can't talk about it, is that it's just like it's yesterday. I still see them. Hundreds and hundreds of people.
To be truthful, you have to really look back to that era and say that every gay man wondered what was going to happen. It was, I would say, universal.
I'd heard, that some people had died, but it was very sudden, and it was not any kind of prolonged illness or anything like that. It was just, they're dead, and it was this thing. They didn't even have a name yet.
We thought that maybe there was something that we were all doing that was particularly causing this, whether it was use recreational drugs or what were called poppers. We just didn't know. So I think that we were as confused as anyone as to whether or not it was something about what was considered a kind of the typical lifestyle of young gay men in the late 70s, early 80s. That's good enough for now, but I wanted you to see the contrast between Carol's enthusiasm, which she carried from the beginning to the end of her role with Chicken Soup Brigade, to today. That video was made just about 5 years ago, so really took a toll on her life and undoubtedly on the lives of many other people who cared for people with HIV/AIDS. Let's see. Can I go to the next one? It was. Yeah, you could do Henry if you like. There we go. Yeah. Gloves, gown, to an extent that I had never seen before.
Physicians should know who's high risk and who isn't. And it bothers me that ambulance drivers still panic when they hear that someone has AIDS. I've just this week had someone refuse to do finish an autopsy when it was suspected that the person might have AIDS. I've had funeral homes charge extra when AIDS was suspected. There's a hysteria that absolutely should not be, because we know what the facts are. The fact is, we already.
Everyone was petrified of AIDS, even though we knew it is not as contagious. All of the hospital personnel gowned and masked and put gloves on and always kept their distance from the patients. And it was a very isolating experience. One fellow who had an incredible will to live, and he was always reading the newspapers hoping there would be a breakthrough. Finally, he did give up, and I remember the nurses telling me that he'd been in a coma since the night before. So I just went in briefly to see how he was doing. And when I put my hand on his wrist, he sensed that I was there. And even though he supposedly had been in coma, he said, "Thank you, doctor, for everything." And then he passed away about 20 minutes later.
Thank you, Dr. Carrick. You played a major role in helping people. And this is Dr. Carrick here. Then, because there was no cure and there was really little hope for a cure, people were desperate to find something that would help them. And these clinics, these guerrilla clinics, began to develop in cities with HIV/AIDS, where people were promoting all kinds of substances to help cure people. Sometimes it would be massive doses of vitamin C. Others, there were, and this is a letter to the editor promoting one of these guerrilla clinics. They had a substance called DNCB solution. Oh, good Lord. It says it's a 1% solution of Vaseline intensive care. What? Anyway, people were desperate. People were going to Mexico. People were going to the Philippines for a healing, for a prayer to become cured because there was no hope. And the medical community wasn't able to help. I spoke to one doctor about this, Mitch Cartney, and he said, you know, we were all learning, the people with HIV/AIDS and the doctors were all learning what it was about and what to do about it. So this is an example of one of the guerrilla clinics, alternative therapy. Now it seems a little bit ironic, but at that time, and it's also tragic too. So people were promoting these cures. Didn't work, of course. Still no cure. Then, as I mentioned, there was so much fear and discrimination. There was an organization called Northwest AIDS Foundation that was created in 1983. And Bob Rohan was one of the people who helped found it. Is featured here on the front page of the Seattle Gay News, the newspaper that would report this kind of thing when other papers didn't have the room for it, that they had a plugged sink and they called Rescue Rooter. Rescue Rooter found out who they were and they said, we're not coming out there, not to an AIDS clinic, to fix your sink. Talk about paranoia and discrimination. Bob was a real pioneer and a soldier in this fight. Then at the same time, 1987, a book came out that covered about the first 6 years, actually it started from the late 70s, of HIV/AIDS and what we learned about it and where we were in 1987. And the book was written by Randy Schultz. It's about a 600-page book. I have it at home. I'm not rereading it. I'm listening to it now on audiobooks. And it's really, really, really good. And the band played on was featured, summarized in the Seattle PI. And of course, I read it carefully because I was so interested in knowing what the hell had been going on with all this time. And Randy had almost a day-by-day diary of what was going on in the U.S. with regard to HIV/AIDS in the major cities in healthcare. So this was the book that named a patient zero, a person named Gaetan Dugas. Now, when I read that, I about fell over because remember this guy? That's Gaetan with me. He was staying with my boyfriend Steve, Gaetan Dugas, the one that's called Patient Zero, because he was seeking treatment, getting treatment at Memorial Sloan Kettering Hospital in New York for KS, Kaposi sarcoma, the skin cancer. And it was beginning to cover his body. This was already in 1981. And I knew he was sick. And I saw the lesions on his body, didn't know what it was. He was a flight attendant for Air Canada, and he had already lost all of his hair because of the treatment that he was receiving for his cancers. But they didn't know what it was either. He was, again, named Patient Zero because when they started to do tracing of people who had HIV/AIDS, many of the cases came back to him as being one of their sex partners. Kept coming back to him, coming back to him, coming back to Gaetan. I had sex with him. So there were hundreds of men who they were interviewing, trying to figure out where is this coming from. And of course, it didn't start with Gaetan, but a lot of it came back to him, and that's why Randy Schultz called him Patient Zero, or named him Patient Zero. So I met Gaetan. I knew Gaetan. I didn't like him. He was a very arrogant person who thought he was the most handsome flight attendant ever. And I'll tell you one story. One night, he and I went out to see the musical Evita. And it was in New York. I think Patti LuPone was playing the major role of Evita. And if you've seen it, there's this incredibly powerful scene where she has died of cancer, and the casket bearers come out on the stage carrying her body in the casket, singing. I think they were singing "Don't Cry for Me, Argentina." And I looked over, Gaetan was sitting next to me, and he was just weeping, tears floods of tears. I couldn't look at him anymore. And I think he was afraid that he was next, because he was so sick already with cancer. That's my Gaetan experience. Shocked the hell out of me when I read that in '87, because I didn't know that had been, that's who it was, and what his role was in that early history of HIV/AIDS. Yeah, the band played on. And Clay Eels went to school with Randy Schultz. He can tell us about Randy. Randy was an incredible author, a writer, reporter, an amazing person who also died of AIDS. I was in Gurneyville, I call it Gurneyville, California, wandering around up in the Redwoods, beautiful place, and I just decided to walk through their old historic cemetery. By God, I stumbled across Randy Schultz's grave. I mean, like, I keep stumbling across these things by or about Randy Schultz. We're almost bound together in this story. So there was Randy Schultz's grave. I didn't even know he had died. So Gaetan was named patient 0, and you might want to see this brief. Am I talking too fast still? No. This brief description. So can you show that again, Chase? Of Gaetan. This is when he had his hair.
And the medical detectives used to describe this man, the airline steward, to protect his identity. Randy Schultz reveals that he was a French-Canadian named Gaetan Dugas, patient 0. One of the first cases of AIDS, the first person identified as a major transmitter of the disease.
It was through Gaetan Dugas that they realized AIDS was an infectious disease. By the time they were done with the study, which became known as the cluster study, they found that 40 of the first 248 gay men who got AIDS in the United States had either gone to bed with Gaetan or had gone to bed with somebody who had been to bed with him. With Gaetan, you get a horrible combination of circumstances. You get a guy who has got unlimited sexual stamina, who is very attractive, so he has unlimited opportunity to act out that sexual stamina, and he's a flight attendant for Air Canada, so he gets these flight passes so he can fly all over and have his fun, in any number of cities. It's just a horrible combination of factors that help really speed this disease into every corner of America.
Bruce, he agreed to be interviewed if we did not use his last name, was one of Gaetan Dugas' many lovers.
Yes, the reporting on Gaetan was pretty extensive because it was so dramatic to have someone named as patient 0. Also, I would say as someone to serve as a scapegoat. As I mentioned, Northwest AIDS Foundation started in 1983, and there were incredible needs for services for people with HIV/AIDS, including hospice and end-of-life care. And Seattle took up the challenge, the people in Seattle and volunteers, to create a hospice. And that was opened in 1992, called Bailey Boucher House, and it's down in Madison Valley. And I don't know if any of you lived in Seattle at that time during the late 80s, early 90s, but at the time that Bailey Boucher was being proposed, a hospice was proposed for that location on Madison Street, there was fairly significant neighborhood opposition. And at one of the public meetings, someone said, "We don't want people like that here." And another person in that audience, a young man, stood up and said, "We're already here." This is an example of how Seattle really met the challenge and still is. POCAN is the name of an organization called People of Color Against AIDS Network. That was an early organization that particularly helped people of color with HIV/AIDS in a variety of services needed. Somewhat parallel, I think, to the Chicken Soup Brigade, but it really met the needs more specifically, perhaps, and comfortably with people of color. And of course, they're facing here budget cuts. What isn't being cut is when it comes to public health. The Seattle Gay News did an amazing job of reporting on AIDS deaths and obituaries. And it was the Seattle Gay News that you went to find out who died last, most recently, who was the last person. This is an example. I just strew these out on the floor of my house to show you some of those. But I have examples of everything that you've seen here is up here. These are old issues of the Seattle Gay News that I was able to save when the Seattle Gay News was being archived by the Seattle Public Library, and they had surplus copies that they were giving away. So you may see those as well. I won't let you listen to the album by Anita Bryant, though. We don't have a player for that. So these are the some of the obituaries. Someone actually at the Seattle Gay News cut out hundreds and hundreds of those obituaries, and they're here, and they're here. When people started learning about the creation of the AIDS Memorial, which I took the lead on because I was a city council member and got funding in the city budget to begin planning for this, they started to contact me and to say, well, I've got these programs of friends of mine who died, and I don't know what to do with them. I don't think anyone cares about these anymore. They may not have known these people. Family may be gone. And so I said, well, I'll take them. I don't know what I'll do with them, but I'm not going to toss them. And so these are examples of memorials. I knew most of these people, but these are memorials that were given to me by friends of mine when they knew that I was beginning to create the memorial. Of course, I did it with the help of city council members, the mayor, a lot of volunteers too. So it just wasn't me, but someone has to introduce the legislation first and take the lead, and that was my job. So these are memorials of friends of friends. You see John and Michael. I don't know, Ron. Did you know them? John Pendleton, Michael King. They loved each other dearly. And John and Michael lived on Queen Anne. And Michael died first in September, and 2 months later, John was dead in the same house. So those are the memorials. There's so many more, probably in some of your homes yet. In scrapbooks, you may have those. Then in 1996, when the first really effective medications were created to help stem off the worst effects of HIV/AIDS, the Seattle Gay News published a list of all the people they knew from the Seattle area who died of AIDS. This is an example of page 1. I don't know if I can, and I'll show you the real page. Just a sec here. So it starts here. It goes on. In small print. Oops, sorry. In small print. And I'm sure there are many more names that could have been added to that or should have been added to that, but that's the best they knew in 1996. So after I became a member of the city council, I saw an exhibit in Tacoma about art. It was called Art AIDS America. It was a very powerful exhibit of art that was created in the 1980s that expressed the experience of the community with regard to HIV/AIDS. And I spoke to some people about that exhibit, and it was so powerful. And some people said, you know, we don't have anything that commemorates that era. And now I know for sure that young people, young LGBTQ people, know little or maybe nothing about that era. And I thought, how can that be? It seems like it was so recently, and it was so traumatic, and it was so profound, and affected so many thousands of people that you see right there. How could we forget that? How could we not remember that? There are a lot of records kept about this. at the Seattle King County Health Department, in the Seattle Public Library at the University of Washington and Washington State. But they're in archives, and they are accessible if you want to look for them. But my goal in terms of creating the memorial, which I hope that you come and walk with me on Saturday, was to create a place, a public place of reflection and remembrance, to tell the stories. We have a really good website of stories of HIV/AIDS that could be improved all the time. And then again, to call people to action to fight HIV/AIDS and discrimination. So that's kind of the whole basis of why we have that memorial now. This is our history, my summary of the history. I'm sure there's much more that all of you have to share, and you can correct me too on things that I got wrong. But we created the memorial. There are medications to help people survive, but there's still no cure. Now, we're going to have the walk on Saturday the 21st at 10 o'clock. We're going to meet up on Capitol Hill at the light rail station. Are you familiar with Glow's restaurant that's up there now? Have you been to the station? The plaza has a big X in it. That's where we're going to meet. Oops. Yeah, it's just north of Cal Anderson Park. Barbara Bailey Way and Broadway. Yes. Somehow I turned this machine off now. So that's where we're going to be. And I've gone on long enough, but I know that some of you have some amazing stories to share. And yes, Ginny, would you like to start? Ginny has been really incredibly helpful. She and Nancy. Nancy's helping to organize the tour. But would you like to share your story first? And then maybe you could just pass the mic to other people who raise their hands. How about that? So thank you.
Thank you so much for this. So Tom and I have had the opportunity to have 2 meals together. And during the first meal, I was sharing with him that as a member of University Congregational Church, I was part of a care team for a young man who had AIDS. He came to our church because someone told him that if he needed a family to gather around him, there would be people there that would do it. And 16 of us volunteered to be his family during his end-of-life period. So I have a couple of stories to tell, but one story I'll tell is we got training over a weekend on how to work with people who were going to be dying, death and dying, and how to be a friend and how to be a support to that person. But Michael, the young man with AIDS, came to our meeting and shared with us that he had grown up in Appalachia and had served in the Navy and had AIDS, and his family had abandoned him. And he wanted some people to be his friends and be with him. And it was just before Easter, so he said, I want somebody here to invite me to their Easter dinner. And at the Easter dinner, I want several generations. I want young people and I want old people that aren't afraid to have dinner with me because I have AIDS. And he described something about his background. He had gone to the Boy Scout National Jamboree. That was a highlight of his young life. And he had a dachshund. Well, that's what my family had. And he shared some other things. And I said to the people there at church, I said, he should come to my parents' house for Easter dinner because I have children that are in high school and my parents are older, and we would all welcome him. And people said, don't you have to ask your parents if it's okay? And I said, no, he would be welcome at the table. And when I went to pick him up at his house, it was the first time I'd been where he lived, he showed me how he gave himself medicine every day, the machines he had to do that, and he showed me the variety of medicines he took. And he said, I want you to know I have enough medicine now that I can kill myself, and I think I'm towards the end of my life, and I want to do that. And so all the way over to my parents' house on Easter, he's talking about how he is prepared to kill himself. And I said, it seemed like a really strange conversation for Easter. But when we got there and we had this wonderful conversation about things that had happened in his life, and he made connections with people in my family, On the way home, all he could talk about is, when do you think your mom would fix us another meal? I want to come back. And it was nothing about dying. So he would call me up and want to go to movies. And I, at that time, was a single mom with 2 kids, and I was taught math in the morning at Mershon High School. I was working on my PhD at the UW in the afternoon. I was in charge of math for the district. And anyway, pretty busy woman, right? But he would call up and want to go to a movie. Well, that was great for me. So one movie, he would choose the movies. And one movie we went to see was about some bad people who had taken over Alcatraz Island. And they were going to release a poison thing that was going to affect the whole San Francisco community. And the only way you were going to be able to live when this gas was released was to take a injection into your heart. You're supposed to stab yourself with a needle and give yourself some medicine. And I leaned over to Michael and I said, there's no way I'm going to do that. I couldn't take a needle. And he said, Ginny, if you're like me and you're close to dying, you will do anything to stay alive. And there were just things like that he shared with me, wisdom. And I'll share that one about his dad too, should I? Or maybe I should pass it on to somebody else, to Dr. Kaharic. Oh, to Nancy.
I told Ginny what a fact she didn't know. My husband was chair of the Sexually Transmitted Diseases Division at the CDC, and he was in charge when AIDS was discovered. His name was Paul Wiesner, and he is it's in the band played on. There's a description of how he dealt with that, but it was, I will never forget all these docs at the CDC. We lived in Atlanta then, and all these docs were just completely floored. They had no idea what was going on, and they were worried and frightened. There was a pall over the whole CDC because it was just, and of course all the places where there were people who were gay, and people just simply did not know where this came from. And it was a number of years, but one of the things that he did, that my husband did, was he took all the people who were in any department at all in his division at the CDC of sexually transmitted diseases and took them off that and put them on AIDS. So they formed this, group of people. And they were the initial people who were studying it. And I will never forget these people who I had thought were educated and knew most of what was going on in the world, simply did not know what was going on when it first came out. And they called it Kaposi sarcoma. I don't know. Yeah.
That was one of the opportunistic diseases.
Yeah. And that was, so.
Anyone else want to speak? Ron? Hi, Ron. Haven't seen you for a while.
Thank you. Nice to see you, too. Gosh, first thing I'm going to do is come up front and say that I'm alive because of Henry Kaharic. I'm one of the people that he has kept alive. Hi, Henry. Hi. I just told him that you kept me alive, which you know. And we have some other fun stories, which we won't get into at the moment, about running into each other all over the world, happenstance. Very strange. Oh, very stance. Quite unknown. We'd run into each other around the globe, surprisingly. And he'd always say to me, Schwartz, are you stalking me? Not really. It was all very funny. But anyway, during those days, I'm what now, 79 years old, and I was diagnosed with it at 87. So I'm one of the survivors. And one of the telling stories I need to tell, and if I get too emotional on this, I'm sorry, but it's part of the story. We had, living in my group home, I had a home with 4 bedrooms, so we had people live in our home, and one of our roommates came down with AIDS. In 32 years old, I was looking at the front page to see if that was his story, because it was either the PI or the Times at the time came to interview him. He agreed to do that. He had been out of the hospital for a little bit where he was completely isolated. We could only visit him with masks and white sheets on, and there was no real exchange. He was sequestered from all things in life. And his family was informed that he was ill. They were staunchly Catholic and rebuked him. They would not acknowledge him. And I remember Ronnie, his name was Ron too. He came to me and he said, "Ron, I don't know what to do." He said, "Can I stay here?" And I said, "Absolutely." He said, "Could I die in your arms?" And I said, "Sure." I did not know the complications from the disease at that time. But anyway, he got as well as he could. It became apparent to us, much to my dismay, that we could not keep him at home any longer. And he went into the hospital, and he, of course, was in seclusion. And Henry, and there was no place for him to go. I think this was before Bailey Boucher, actually. And Henry intervened and called his family, and they refused him. The mom was sympathetic, and she agreed to come out and get him, and the family told her no. But she came out with her husband. They refused to meet us. They would not come into our house. And my mouth is getting dry from this. He went home with them. I couldn't hold him in my arms when he passed away. And his family was very unreceptive to him. So from what I understand, his final moments were spent, ignored and chastised by his family. And he died. And it was from there that when the medicines came out, we all became so thankful that there was at least hope. He had no hope. There was nothing at the time. And during the Reagan era, of course, we were totally chastised. But there's a number of us out there who are alive because of this man right here. Simply that. He took great care of us, as it's been heralded in a couple books. And I, for one, am eternally grateful for him. Thank you.
Thank you, Ron. Those stories are really difficult and very emotional, no matter how many times we think about them or repeat them. It is something that those are stories that will live with us for the rest of our lives. I think when I'll get back to you. My partner died, Steve died in 1988. And to me, it was like the watershed of my life. When I think of, I'm fortunate to be in a loving relationship and married now. But when I think of in the past, I think, was that before Steve died or after Steve died? When someone talks about something kind of way in the past, it's like, I didn't even think of it. Was it 1998? I think, was that before Steve died or after Steve died? That's kind of the watershed, the continental divide of my life. Congressman McDermott.
I'll see if I can get up on my feet.
You're there. So far, so good.
Coming here to see Tom, I've known Tom for many years, since he was the assistant to Jeanette Williams in the city council, so I've known him for a long time. And I, as you all are experiencing, you can't remember what happened yesterday, right? And I can't remember exactly the dates, but I can tell you generally what this epidemic was like. In the early days that Tom described here, I was in the state legislature in 1982, and I put the first $200,000 in the budget for educating students in schools, requiring that every school have a program to educate children in their health education system about what AIDS was and how you prevented it and what you could do about it. And there was really no hope. Everybody got it, they were going to die. That's just the way it was. Until the 1990s, there then became the drugs, the antiretroviral drugs came on the scene, and it was then there was hope. Now, I had many experiences when I was in the legislature. Harborview Hospital had a unit on the I don't know, 8th floor or something over there, and they took care of AIDS patients who were in terrible shape medically, and they got them all stabilized, and then they would put them out on the street, and they didn't have anywhere to go because they'd lost their house, they lost their family, they didn't have anybody, so they wind up in the shelters. Well, the shelters is a perfect breeding place because everybody lies on the ground, and there they are, and it's all you've got in these places were people dying of AIDS. And one of the doctors at Harborview came to me and said, "Jim, what we need is a program to allow single occupancy for people living with AIDS, so they can, if they get out of the hospital and they're healthy, they shouldn't be among people where they're going to be continually getting infected and getting all the other diseases they were getting with them." And so Nancy Pelosi, who you may know, and Chuck Schumer, who you may know, and me were in the House of Representatives in 1989, and we went to the chairman of the Housing Committee, who was a man named Henry Gonzalez. Henry was an old Mexican-American from San Antonio, Texas, and he had no idea what AIDS was about. I mean, he had no idea. He'd never heard of it. And so we went in, the three of us, because we were representing the 3 cities that were really central to what happened in the disease. We said to him, we explained AIDS to him and said, we need a housing program for people living with AIDS. And so HAPWA, Housing for People Living with AIDS, was created in 1991 and it is still going today. Bailey Boucher was an example of one of the places where you were setting a place up for people who had AIDS or who were recovering or had some chance of living. You had a place where they could stay. And I think that was one of the high points of my career, was making it possible for people to have a chance to live long enough for us to get to antiretrovirals. Now, when in the days when I went to Congress in 1989, and I had been in Africa, living in Congo, in the midst of the epidemic, which was very heterosexual. It was not a gay man's disease in Africa. It was, everybody had it. And so I knew that it was going to be men and women, and it was going to be like that in the United States. So I went to Tom Foley, who was the speaker then. And I said, "Tom, you got this epidemic and nobody around here in the Capitol is talking about it." Well, he said, "Why don't you start a caucus?" So I started the International HIV Caucus in the Congress in 1989 and had seminars, and we had all kinds of educational opportunities to get people in Congress thinking about it, because nobody wanted to think about it. It's the only, you talk about congressmen traveling here, there, and everywhere. The only trips that I never could find anybody to go with me on was a trip to see something about AIDS in South Africa or the Congo or someplace where I knew there was a real epidemic. And the change in the country was, and I'm going to say something you will very rarely hear me say anything good about George Bush. George Bush started PEPFAR. Now, PEPFAR was the president's program to spread the use of antiretrovirals worldwide. We spent millions, billions of dollars actually on the treatment of people with AIDS, because we discovered that if you gave the medicine to the mother before the baby was born, she would not transmit the disease to the, she would not, excuse me, I was being Irish. She would not transmit the disease to her baby. So you could finally have a woman who had AIDS but could deliver a normal baby without the disease. And that's what President Bush did. And I consider him a real hero. That program is something that what they're doing now and cutting out that program, and by cutting out the USAID money for it, is just absolutely criminal, because you've got about 40 million people in the world who are living as people in this room are on antiretrovirals, and they can live a normal life. And in 1988, nobody thought you could ever live a normal life again. But now you can, if you're careful and thoughtful and follow the rules. And I think the history of this disease shows you that every disease gets to be political, because it was all gay men's disease when we started. And part of, I happen to represent, when I came here, I had the 43rd district, which is this area right here, and up on Capitol Hill and Queen Anne and so forth. And I think I had about 90% of the gay people in the state of Washington in my district. It was a place where they felt comfortable, and there were lots of them living around here. And none of them were out in the open. They were all hidden. And the problem for them came when somebody who had AIDS got sick and their partner couldn't go to the hospital to see them, because the hospital says, well, are you a family member? Are you related to them in some way? And they would have to say, no, he's my boyfriend, and I've been with him for the last 5 years or 10 years, but I can't go and see him because I'm not family. And that's when the gay marriage and the civil unions and all the people began to come out as gay people in this society. That was a large part of it was driven by the need to be able to see people who were close to you and were dying, and you couldn't go and see them. You couldn't go into the hospital to see them die. It was an awful situation. So there was all kinds of things. And Tom, I'm pleased that you're doing the memorial thing, because this is one of those issues where, as you know, everything, if it didn't happen yesterday, most people have forgotten it. They probably forgot what they had for lunch today. And so you really have to keep telling people the story of AIDS, because it is a very important public health issue, which we went through with COVID. We did the same thing. We made the same mistakes in some ways, but we have to support the public health people and get the government to really pay attention to public health. It's an important part.
Thank you. I wish we had a Congress like that today. I have some folks over here too that I haven't been able to get to yet. So who's next? Just identify yourself, please.
Hi. I was part of a mother's group during that horrible time, and what we did was make a memorial quilt, and we each made about a 6-foot piece to be part of the quilt that went all across the country, and I believe it's still going. The last I heard, it was getting tattered, and it needed repair, but it is still traveling. And I'd like to know right now where it is, but we did do about a 6-foot piece of for the quilt. So.
Thank you. What is your name?
Judy Talley.
Judy what?
Talley.
Talley. Well, if you give me your contact information, I'll find out where the quilt is or where pieces of it are, because I think that it's been divided up into different parts of the country. So we'll see if we can run that down for you. And at the end of the meeting, maybe you can give me your email address.
I was a volunteer at Bailey Boucher in the 90s. It was an uplifting place, if you can believe it, because of the compassion. It was the first building that was built from the ground up to take care of people with AIDS, because the hospitals, like was just said, didn't want the patients, or they would put them off in a wing, if anything. And so Virginia Mason sponsored, as did Boeing, Weyerhaeuser, and Nordstrom, to build Bailey Boucher. We had 2 floors of skilled nursing. There were 35 beds. And then we had on the main floor a day room where clients could come in and get meals, get some health care, and then leave at the end of the day. My first volunteer position was driving them. I'd go pick them up from wherever they were to come in for the day. And then I worked at the front desk, and it just was an uplifting place. And the neighborhood did come around, and they were great supporters. And when I started in 92, there were 400 volunteers. And so we had a program to educate those volunteers, so when they're out in the community, they were knowledgeable about this disease and know you didn't get it from touching someone, you didn't get it from the restaurant, etc. So we had a panel of experts, doctors, psychologists, nurses, caregivers, for a day-long conference. And when I first started volunteering, I didn't tell anyone I was doing this. And so then that's why I wanted to get educated, because I wanted to come back with knowledge. But it was just a wonderful place.
Thank you. Let's see, who did I miss? Anyone else? Okay. Someone said one more. Okay, well, that's what it'll be. Pardon me. Hi, Karen.
Well, I was a nurse at Swedish Hospital when they first came, and the part that remembers me the most was that I'd go in and try and make them feel comfortable, because they'd been fighting with the family that came to see them. That was our job as a nurse, to try and keep them company in room. So that's awful.
Wow, thank you for doing that. Did you want to say more? I know, it's still emotional, isn't it? Yeah. It lives with us every day. Did you know Margot Baikonen? I think she was there too, but she was one of the first people to treat people with AIDS, nurses. Well, thank you so much, everyone, for coming here tonight. I didn't know what to expect, but in talking to Gini, on the AIDS Memorial Pathway, yes, let's talk about Saturday. If we have weather like today, it'll be wonderful to walk up there. So we'll meet at the plaza at Barbara Bailey Way and Broadway. It's just a little bit in on the plaza of the light rail station. There's a big X there as part of our artwork for the AIDS Memorial Pathway, right outside of Glow's restaurant. And there's a whole story about Glow's that I could tell you about, but I'll do that at the plaza, because it's a really interesting story, heartwarming story too. There was a person named Glow's. So we'll meet there at 10 o'clock, and then we'll walk down the pathway to the various works of art that were commissioned by us, volunteers in the community, that represent various stories and aspects and memories of HIV/AIDS. There's the big X. There are these simulated protest signs that were made from the language on the protest signs that were used in Seattle. One of the things that I mentioned when I was talking about Bailey Boucher, when someone stood up, Brian Day is his name, as a matter of fact, stood up and said, "We're already here." One of the protest signs is, "We're already here," and that's the name of that piece of art. And then there are some glass sculptures also that are illuminated that have words embedded on the inside, words of memory. They call them murmurs. So several monumental pieces of art. It's a bit of a challenge to keep it maintained. There's a lot of vandalism up on Capitol Hill at Cal Anderson Park, but we have volunteers. We were out there about a month ago, and we did some weeding. We passed mulch around. We had really a great deal of fun. If any of you want to come and help us maintain the memorial area, I would always welcome that. I think what I'll do is I'll get a sign-up sheet. I didn't bring anything for sign-up, but I'll do that on Saturday. And after you see the site, maybe you can decide whether you want to help us volunteer at that site. And one of the great things is that we recorded this meeting, and I think that your stories are so powerful and so important, such an important element of our history, that I would like to put it on the AIDS Memorial website, which is a very simple one. It's just theamp.org, www.theamp.org. That's it. Jenny, did you want to say anything? Something?
Well, thank you. Let's thank Tom again for coming and being with us this evening. Thank you so much for coming. So we're hoping that a number of people want to go on this to the AIDS Memorial Pathway. I've been there before. It's level enough that if you had a walker, you could go. You can use walking sticks. We have the Horizon House van arranged to drive people up to the site and back. So far, only 3 people have signed up, and I'm one of them. So that's not a good representation. I'm hoping that more of you can join us on Saturday. You sign up with the concierge with Jess, and it needs to happen tomorrow because we need to let the driver, Jenny, know whether to come on Saturday to drive us or not. But it's interesting. I found the signs to be very inspiring that were there, and I thought the artwork towards the end of it was quite lovely. I think it's worth doing, and then we can get a few steps in too, right? So I invite you to join us, to consider coming on Saturday to that walk. And Tom will lead it. And I have the microphone for him to use while he talks. So thank you so much.
Sure. And then if anyone wants to look at these items that I have up here from the old Seattle Gay News or any of the other artifacts, you're welcome to look at those before we all leave. Thank you, everyone, for being here. I really appreciate it. Thank you, Dr. Koharek, Congressman McDermott, Representative Armstrong, many others.